You are welcome to today's video productions on Mature Healthy Life. Our today's topic is management/treatment of goiter. In our previous video, we talked about the complications of goiter. Then that brought us to today's topic, treatment and management. Number one, how to manage a patient with goiter is to provide a calm environment for him or her. Yes, calm environment is very, very important for a patient with goiter. Another thing you get to do, check the vital signs, especially the pulse and the blood pressure, because these two things can tend to rise because of the presence of hyperthyroidism. Yes, in the presence of hyperthyroidism, pulse and blood pressure can arise. Two of them, they can increase in function. Then another one, you have to listen to chest pain. Check the chest pain. Yes, check whether there is a presence of chest pain. Why you should check is because there can be a chest pain due to the workload of the cardiac. In the presence of hyperthyroidism, the heart tend to increase in function, thereby getting so much load that is bestowed on it. That is why you check for chest pain. Another one, you listen to murmur. Yes, on how the cardiac is beating, whether the heart is beating as required or it is murmuring. That is why you have to check for chest murmur or heart murmur. Listen to murmur. Another one now, you obtain ECG, electrocardiogram. You obtain it because arterial arrhythmia may be present because of the presence of hyperthyroidism. You understand? Irregular heartbeat, it can be present. So you obtain electrocardiogram. Another one, you teach the patient how to relax. A patient with goiter or hyperthyroidism needs to relax. So you teach him how to relax so that his airway can tend to be patent in the presence of relaxation. Another one now, you administer medication. Yes, medication administration is important based on prescription, on how the caregiver prescribes it. That is how you administer. It's very important. Another one, you check the input and output of the liquid that the patient is taking. The amount of fluid he takes, you record. The amount of fluid he is producing, then you record. Whether by oral or by infusion, record it. Then, another one now, you check the patient's weight every day to ascertain whether he is gaining weight or he is losing weight. That is why you have to check for his weight every day. Another one now, you educate such patients on the need for thyroid surgery. Yes, when a patient hears that he's going for a thyroid surgery, he can tend to be anxious. So when you give him education, tell him what is involved in the surgery and what is not involved in the surgery. It can also relax his mind. So that is why you have to educate him on the things that are involved in it. Then you also educate him on another procedure called radioactive iodine. Tell him the implications of this procedure, how it may damage his thyroid gland, so that he make a rightful choice on the one to take. Then you also provide oxygen for the patient. If the oxygen saturation of this patient is less than 94%, then you provide oxygen saturation so that the patient doesn't go hypoxia, that is below oxygen level of intake. So that is why you provide oxygen below 94%. Another one now, you provide cooling blanket. If the patient now tends to have fever, if there's the presence of fever in this patient, you provide cooling blanket for him so that he doesn't go hyperthermia. That is, his temperature doesn't rise beyond the normal. So that is why you have to provide this cooling blanket. Another one, you check for thyroid function lab. Yes, thyroid function lab. That is the thing you check finally, so that you obtain the laboratory result and know the status of this thyroid gland and the goiter. So thank you, my brothers and sisters. Having listened and watched this video, please, I urge you to subscribe to it. Hit the like button, comment on the comment section, ask us your question there, share this video, I beg, please, so that our people that need it will get it. There's a lot of people are there who are passing through all these goiter problems, but they're ignorant of how to manage them. So I beg you, please, share the video, subscribe to our YouTube channel, Mature Healthy Life, and hit the like button. Follow us on our Facebook page, Mature Healthy Life too. Thank you as you share.